G'day guys, it's Scott here and welcome to another Pod TV. Tonight I want to talk about what is the definition of a health practitioner to you. I really want you to think about this, and in these times where we've got the COVID-19 virus running rampant and the countries are closing down, where do we stand as a health practitioner and how is that defined to you? So what is our scope of practice and what are our responsibilities to people? Now, I don't want to focus on the COVID-19 virus. Obviously, we haven't posted a lot directly as us, but you as a community are talking about it lots and lots. And there's a couple of Facebook communities that have been set up around this directly. I guess for us, it's very important information, but we're not the experts, and you should always be looking towards, obviously, the experts in this, like the government and our association, for the best advice. So, before we do that, we'll do our general sort of admin. Very disappointingly, I have to announce that we have postponed all events at this point in time. We are willing to offer full refunds to anyone who has purchased a ticket, but all people that are holding tickets at the moment, the events are postponed. We will intend to run them in 2020. That might be later in the year, but we will honour those tickets, and tickets will go back on sale once the government restrictions release. And obviously our hands are tied because it is a government situation. So please, if you do have something, just reach out. But I hope that you guys will continue to support us and have faith that we will honour those tickets for you, which we will. And if it's not this year, look, the honest truth is it will be next year. But please reach out. Otherwise, thanks for everyone who has jumped on courses. It's been super supportive. Apart from that, we do have some things coming on that we'll be offering online to continue our sort of CPD theme, and we're looking at a pretty cool idea which we'll launch very, very soon. So I'm very excited to get on board with that. But let's move on. What is a health practitioner to you? A health practitioner to me is someone who is well educated and knowledgeable about a general well-being and healthy practices for someone. So that's things like as simply going to the dentist on a regular basis, getting your eyes checked, what I guess healthy weight I guess is, looking, that's a healthy weight, that's not a healthy weight, those kind of things, just general. And I mean, I say very, very loosely general. Though we're podiatrists, how many people do you have come into your clinic and they say, hey, I've got plantar fasciitis, blah, blah, blah. Oh yeah, and I know I probably could lose some weight. Geez, that's the old, dropping, cringe, don't want to talk about it. The way I've learned to talk about that is I say, yeah, look, everyone could lose some weight probably. And yes, we know it's not a healthy thing to have extra weight or an excess of weight on. And yes, that could be contributing factor. So you should focus on that goal as well while we get this foot fixed up. Now, in saying that, I haven't given them advice on how to lose that weight. I've just gently reminded them, yes, you should focus on that goal because it will provide a better outcome. It's the same as someone goes, oh yeah, I drink and I smoke. Well, yeah, those things aren't really great for you. Smoking, the research isn't definable enough to get smoking outlawed, So just something to sort of poke the bear and think about. But I think in regards to this, we do need to think of ourselves in these really strange times and with this virus about the wider health of what we can provide for people. So when someone comes in, we should be taking a general assessment. We already do. Are you active? What type of footwear do you wear? What type of social activities do you? Because you'll get that through your general relationship building. And then what's your problem, so on and so forth. Do you have any other health issues? We can assess that. Now, I'm not going to say to someone, hey, you're diabetes, you need to get your HbA1c to 5.1, you shouldn't be taking that drug. No, but I could say, hey, that 10 isn't a great level to be at with your HbA1c. You definitely should talk to your doctor, endocrinologist, or your dietitian about how you can manage that and get that down. I don't think it'd be adverse to say, hey, get a health diary and start noting your levels and take that to your doctor. It will really help. It's about taking care of their well-being, and as the expert at a base level of understanding well-being and healthiness, I should be able to promote that gently with my clientele, I think. Now, I don't think I've ever gone and told someone they need to do this many sit-ups or this many crunches or they need to eat this amount of food, but I've always directed them to the person who can tell them that, which is an extremely powerful thing. And if you get that right and people do connect with the right people, they are empowered and they will see change. So let's talk about quickly, and I will, but the COVID-19. Why can't we gently remind people and encourage people to do the right thing? Yes, you should be hand washing. Yes, you should be social distancing. Yes, you should be staying away from people of high risk. Yes, no, you shouldn't probably be going to the beach. It's probably not the best idea. Those types of things are, I'll use the word gentle reminders, and gently encourage people to do the right thing. These are things that we should be doing as health practitioners. Gently reminding and encouraging our clientele to do healthy things that are backed and researched through. Now, you get the client who comes in and goes, I cured my cancer by eating all natural, eating pawpaw seeds, rubbing whatever ointment on the site. Yeah, Johnny, that's fantastic that you're better and your cancer's gone away. What an incredible outcome. You know, but there is no science behind that, so I can't really give you any more discussion about it. I can't really tell you how that's worked, but that's just fantastic for you. I think that's what you've got to do. You've got to focus on those alternative medicines sometimes, or those alternative things, and go, yep, let's focus on the outcome. Johnny doesn't have his problem anymore, cancer, foot pain, or whatever. But I can't tell you why, Johnny, and I'm not going to encourage you or tell you what you should be taking or telling your friends to go do it. And I'm not going to tell other patients to do it. But that worked for Johnny, and we're going to celebrate his best outcome. So as a health practitioner, I think we should be encouraging people to gently remind people and gently direct them towards healthy habits. And we should be responsible for knowing those ourselves. But then we should also be gently reminding people of things that aren't scientifically based, and reminding them that that's a great outcome and celebrating those wins, but making sure that they're not going out and spreading the myths and legends that, unfortunately, misinformation, as we can see in this time, is never a great thing. So let's be responsible health practitioners. Let's look at our people on a whole I've just lost that word. So dynamic social sort of model, and let's really focus in on making sure they leave our presence with a better understanding on how to be healthy people. All right, guys, thanks heaps for that. I look forward to seeing you guys next week. And as I said, I look forward to the announcement we've got coming about some new stuff we're going to bring to you guys to keep people interested while we are on a bit of a lockdown situation. See you guys.